Raise your hand if you're familiar with cardiovascular diseases. Would you believe me if I said the leading cause of death worldwide and in the U.S. is related to CVD or some form of cardiovascular disease? According to CDC, one person dies from CVD every 33 seconds. Today I'm hoping to inform you about the number one health issue we face today. I'm going to talk about the three most common types of CVD, the causes, treatments, and symptoms related to these diseases. After this speech, I hope you all can see how common and dangerous these diseases are. According to CDC, on average, 697,000 people die annually from some form of CVD. When it comes to heart attacks, 1 in 5 of the people who experience heart attacks aren't aware that they're even having one. It's pretty frightening to know, and most deaths worldwide are caused by cardiovascular diseases. The first form of cardiovascular disease is the coronary heart disease. It's when there's a buildup of cholesterol in the arteries, making it harder for the heart to pump blood. So the causes for coronary heart disease is lack of exercise, and it doesn't develop overnight. It takes a decade for the plaque of cholesterol to build up until one day strong emotion or a big meal can cause a heart attack. Other causes are years of eating high cholesterol foods full of trans fats in packaged goods and a lot of saturated fats and meats. Lack of exercise over the years. The most common reason for getting coronary heart disease before the age of 50 is related to genetics. Symptoms include chest pain, discomfort, weakness, lightheadedness, nausea, and shortness of breath. And treatments include stents and balloons, surgical treatments like heart transplants, and the best one is changing your habits. Alternative to stent procedures. According to an academic one-file article called Current Tool Set of Predicting Coronary Events, states that acute coronary syndrome can be treated with antiplatelet drugs, or drugs that prevent blood clots. Here's a picture of a balloon or a stem being installed in the artery. Basically is installed and it expands, which improves blood flow. And here's an image of what coronary artery disease looks like. It's just a buildup of plaque, cholesterol. Now that we know a little more about coronary heart disease, the related causes and treatments available, I'll be moving on to the next subject, the stroke. There's two types of strokes. There's the ischemic stroke, which is the most common type, and it's related to blocked arteries. So that could be related to coronary heart disease. And hemorrhagic stroke, which is related to blood vessel rupture in the brain due to trauma or overuse of blood thinners, which weakens the vessel walls, which in turn causes ruptures. Research article on ischemic stroke states factors included a history of hypertension, low levels of physical activity, psychosocial stress, smoking, and excessive alcohol consumption. Symptoms are lack of coordination, dizziness, numbness on one side of the body, and fatigue, even loss of speech. Treatments for ischemic stroke is TPA injections, which break down blood clots. And for hemorrhagic stroke, it's surgical treatment where they have to come in and stop the blood flow and drain out the blood. Now here's a picture of what a blocked artery looks like, which is related to ischemic stroke, and a ruptured artery. And here's an image of a surgical procedure for a hemorrhagic stroke, where they clip off the ruptured artery. In addition to strokes, heart failure is another form of CVD that causes a lot of deaths worldwide. Heart failure is a condition where the heart can't properly pump blood throughout the body. Some of the causes, another cause is coronary heart disease, high blood pressure, irregular heartbeats, and this is usually affected by another form of CVD. Symptoms include swelling in certain parts of the body, like legs or your arm, weakness, can't properly exercise, and shortness of breath. Treatments for heart transplants, pacemakers, coronary bypass surgery, which clean up the arteries. A scholarly article on treatments for heart failure states, heart transplants do occur, but not as frequently as they are needed. To truly cure an injured heart, stem cells have been suggested and are currently being studied. However, the problem with stem cells is there is detrimental immune effects, responses when you're working with stem cells, so that's being currently studied right now. Here's an image of a permanent pacemaker being installed, and you can see it generates a pulse, which helps your heart pump the blood. And here is one of the symptoms of heart failure, which is one of your foot swelling up. To conclude, coronary heart disease is a buildup of cholesterol, which makes it more difficult for your heart to pump blood. A stroke is a lack of blood supply to the brain, or a blood vessel bursting in the brain due to trauma or other reasons. Heart failure is a weakened heart that can't properly pump blood throughout the body. Here's my sources. In short, it's important to be aware of these cardiovascular diseases, not only because it's the leading cause of death worldwide, but also because a lot of this can be prevented with just proper habits. Thank you.